Hi everyone, I am Dr. Sofiya. A cesarean section, also known as C-section, is a surgery to deliver a baby via the abdomen. A C-section occurs when a physician determines it to be a safer delivery option for mother or for baby or for both. Mothers may also choose to have a planned C-section called an elective surgery, which is usually scheduled at 39 weeks of pregnancy. Also, women who have given birth via cesarean section before are often advised to give birth via C-section for the next baby. Common indications for C-section includes labor dystocia. Labor dystocia can occur due to baby's head is too big to fit into the pelvis. Another indication for C-section is placenta previa, when the placenta wholly or partially covers the opening of the uterus. Sometimes the baby is in breech position, so the feet are down instead of the head down. A prolapse of the umbilical cord or the fetal distress before the full cervical dilation can result in the loss of oxygen to the fetus or may even result in stillbirth. Also, when a mom has twins or even more babies at the same time is usually an indication of a cesarean section. Other indication includes a pelvic tumor or a cervical cancer, active herpes infection, macrosomia. It is when the baby weighs more than 4 kilograms. Procedure of C-section. The procedure begins by inserting a angiocatheter into the patient's hand. Also, a bladder catheter is inserted. There is usually a sheet between the operation team and the patient's head so that the patient cannot see the surgery herself. Different anesthesias can be done: general anesthesia, regional anesthesia. In general anesthesia, patient is not conscious and the baby will receive some other medication which can lead to sedation of the child. So which usually has to be done when the surgery has to be done in an emergency setting. Regional anesthesia, such as spinal anesthesia, is the method of choice in which the spinal nerves are numbed and the baby won't receive any medication. The patient remains conscious but will not feel the pain. Now the doctor will begin by making an incision on the skin. There are different skin incisions, a vertical incision and more often an horizontal incision just above the pelvic bone, usually above the bikini line. After the skin incision, the fascia of fat, muscle layer and peritoneal layers are cut. The urinary bladder is carefully pushed to the side to protect it. After the incision to the uterus is made, the doctor will rupture the amniotic sac. And the baby can be taken out of the uterus. Then the umbilical cord is cut and the baby is wrapped in a warm cloth for the first examination. The placenta will be gently removed from the uterus. And the cut layers are now sealed by together. The whole duration of the cesarean section is around 15 to 20 minutes of surgery. The mother stays in the hospital for 4 to 7 days. Walking after the C-section is necessary to speed recovery. This can help ease gas pains, help you have a bowel movement, and prevent blood clots. This was the procedure of the cesarean section. I hope you all found this video helpful and informative. The incision usually heals within 8 to 12 days over time. Your scar becomes thinner and flatter. The scar either turns white or the color of your skin. If you found this video helpful, please don't forget to like or subscribe to our channel for more informative videos. Thank you for watching.